just have two more topics that we want to hit on for the truth today. We're going to talk a little bit about single-payer prospects in Rhode Island and women's reproductive rights, and then we'll close out the rally. So with that said, we'd like to welcome Dr. Mark Ryan of Single Payer Rhode Island, a relentless advocate for healthcare for all.
I'm a little bit behind Congressman Cicilline. Good morning. I'm going to do some reading because I wrote a very long and boring speech last night, which my wife chopped to pieces, so I don't know the speech. So, as you heard, I'm the chairman for the Rhode Island chapter of Physicians for National Health Program. It's a nationwide organization of so far 20,000 physicians who are advocating for a Medicare-for-all, single-payer national health insurance system, which is where we need to be. So since this is March for Truth, we need to know or remind ourselves what are the lies out there. And there are three big lies. There's a lot of lies, but three big ones. First one, that American healthcare is the best. Everyone loves it. It's the greatest. The second lie, and I'm not saying who's telling these lies, I'm not going to smear people. The second one is, we can fix our problems with the American Health Care Act, Trump Care. It's the best and everyone loves that. And then the third thing is, single payer or improved Medicare for all cannot work. It's just a Bernie Sanders fantasy, in my view. So, let's tell some truth. American healthcare is not the best at giving our citizens access to care. In 2010, just prior to the passage of the Affordable Care Act, almost 50 million Americans were uninsured with the ACA. That number has dropped to 28 million, but will probably not fall any further. This is a problem. People die when they are uninsured at the rate of 1 per 1,000 per year. Raul Labrador in Idaho seems to think differently, but you'll notice his constituents yelled him down. We know better. Even with the ACA then, with 28 million uninsured, 28,000 Americans are going to die this year because we can't fix this system. And with underinsurance, people who have to pay more than 10% of their annual income in their health care, the number is probably larger, but it's harder to track. We are the only industrialized nation in the world that does not recognize health care as a right and guarantee universal coverage. We are not the best. We're not the best because we spend too much and we get too little. We spend roughly twice what any other industrialized country does per capita on our healthcare system. And 1/3 of the money we spend is wasted. It goes not to healthcare, it goes to pharmaceutical company profits and to ballooning administrative costs in the private health insurance industry. The pharmaceutical companies will tell you they need the research they need the money for R&D. Let me give you a good example of that. There's a new drug called Harvoni. It's the first drug that actually cures hepatitis C, a lethal disease that kills millions. How much money did Gilead Pharmaceuticals spend to develop Harvoni? None. This drug was developed with NIH grants, with your tax dollars. The guy who discovered it snuck out of his university, Drexel University, in the middle of the night, founded his own little healthcare company, and was immediately bought out by Gilead for $440 million. So a drug that costs pennies to make is now upwards of $40,000 for a course. The pharmaceutical industry is the largest legal extortion racket on the planet. The health insurance industry produces waste. Between 1970 and 2010, the number of practicing physicians in this country rose less than 2%. Over the same period of time, the number of people involved with actually processing the bills, denying your claims, trying to prevent you from getting health care, rose 3,000%. And that's where the money is going. Health insurance premiums are rising at a rate of 5% per year, more than double the rate of inflation and the rate of increase in workers' wages. Massachusetts General Hospital in Boston, fairly well known, pays 350 people just to do their billing. In Canada, which has a single-payer Medicare for all insurance system, Toronto General, which is a size similar to Mass General, roughly the same number of people, guess how many people they have processing their billing?
I know. Right.
Well, not zero. They're close to it, though. Three. The U.S. pays twice per capita And some will lie to you and say Americans get too much care. That isn't true. Blue Cross tried to make that point recently when they announced that they were losing $35 million last year. By the way, they let their outgoing CEO and CFO go for $1 million apiece with severance packages. Only $1 million. They were very restrained, I agree. But we do not get too much care in this country. The truth is we have the lowest rate of days spent in the hospital of any industrialized country. Our aging population is on average younger than any other industrialized nation. We do not spend too much in providing care. We spend too much in overhead. We have a healthcare system that is the major cause of personal bankruptcy. 62% of people declaring bankruptcy in 2012 did so because of healthcare costs. And of those, 75% had health insurance at the onset of the illness that bankrupted them. Because what happens in the United States? You become sick, you lose your job, you lose your health insurance, you lose everything. Speaking of Canada, here's a big lie. Canadians don't come to the U.S. for health care. I don't know if anybody saw Ali Velshi doing the smackdown at Jim Jordan of Ohio, but it's a lie. It's based on a really crazy study that's done every year by a very conservative institute in Canada called the Fraser Institute that tells us 40,000 Canadians come here to get care. No one can find them. A study done a number of years ago actually showed that of the largest hospitals in the states that border Canada, 40% of them never saw a Canadian on any given month. And of the Canadians who did get care in American hospitals, 80% of them were only getting care because they got injured or fell ill while they were traveling in the U.S. Canadians do not come here to get care. We can't afford to get care here. Do you think Canadians are wealthier than we are? So the final lie, which we've already heard a little bit about, is the American Health Care Act. Actually, that's a second lie. I think we've heard enough about that. 23 million people losing their insurance over the next 8 years. The one non-lie they told is healthcare premiums will go down by then. But what they don't bother to tell you is that the price of insurance for the ill and the elderly is going to go up so much they'll drop out of the market. So the estimates for the average premium will come down because only healthy people can afford to pay them. Give you an example from that was done recently. A 64-year-old man making $26,000 a year under the American Health Care Act will be paying $13,000 annually in health care premiums, up from $1,700 right now with the Affordable Care Act. It's not a good plan. It's a lethal plan. It's going to kill people, which is why the Senate almost certainly will not pass it. But in the words of Charles Krauthammer, that well-known liberal, they'll probably come up with some rickety system that won't work. And this Krauthammer said this. You can actually look at the Fox clip on YouTube. America will be in a single-payer system within 7 years. Charles Krauthammer said that. So can a single-payer system work? Well, I don't know. There's so little evidence, since virtually every other country on earth is doing it. Canada enacted single payer in 1972. Since then, they have not had to make any major reform to their healthcare system. We've tried 5 times. The Nixon-era employer mandate, the HMO experiments of the 1980s, the failed Clinton Health Care Act in the 1990s, the Medicare Advantage Act in 2003 under Mr. Bush, the Affordable Care Act, and now the American Health Care Act. I mean, shouldn't we be looking at other countries that are doing this correctly and maybe take a lesson from them? In Congress right now, we don't have great prospects, at least not until 2018. Our Congressman Cicilline, thank God, has now signed on to the ACA. Our other 3 congressional delegates have not. I have seen Senator Whitehouse move further and further to the left on this issue, mainly because you guys keep showing up at his town meetings, wearing your single-payer buttons, asking single-payer questions, and making him think about it. And if we see any concrete evidence that you guys showing up for this stuff is working, listen to our congressional delegates, because they are beginning to realize they can take these positions and you guys will support them. In fact, you guys will force them to do this. Because our prospects in Congress are not so good right now, we have visionary people like Janine Calin, like Gale Golden, like Aaron Reisenberg, who have introduced single-payer bills into our legislature. That's how Canada did it. In 1962, the province of Saskatchewan, with roughly 1 million people, enacted a single-payer system which was so successful it was nationalized within 10 years. And as I've already mentioned, it hasn't had to be changed since then. Senator Calin is going to try to get a study commission done so that we can actually have official data on this, so that we can make it into a real thing and not just some crazy Bernie Sanders idea. But as long as all you crazy people keep signing up, keep showing up, this craziness may actually come to pass. There's more information at Single Payer RI on the web, also at pnhp.org on the web. America needs to join the rest of the civilized world and guarantee health care as a right. We're going to make it happen.